Welcome to the Pottstown Area Health and Wellness Foundation's webisode series on the opioid crisis. I'm your host, Beth Trapani, and in this episode, Real Pain Matters, we're doing an overview of the opioid crisis. And I am joined today by Bridget McGivern, and you are CEO of Community Health and Dental Care.
Hello.
And Dr. Andy Trenacost, CEO and Clinical Director of Creative Health. And you both service the Tri-County area and have locations right in Pottstown. So thanks for joining us. Let's start out, for people who don't really know, we hear a lot about the opioid crisis, but what is it?
Okay. So the opioid crisis is the term we're using to point out that deaths from things like prescription painkillers and heroin are significantly on the rise, becoming more frequent, more problematic, to the point when illegal substance use, primarily of the opioid type, is the leading cause of accidental death in the United States. We have hundreds in our own region and counties every year. We had a 50% increase in 2017 in related deaths from opiates. There's a lot of myths and a lot of facts around that. One of the myths is that this is somehow an illegal street drug problem, and in fact, the reality is that most overdoses are caused by pill form opiates, the kind we originally get from doctors that we can also buy in the streets, and heroin is secondary to that.
They're very common painkillers. Can you give us an example? Maybe you go in for surgery and you end up coming home with an opioid. What kinds of drugs are involved in that category?
A lot of pain.
Things like Percocet,
Yeah.
Vicodin, most of the major heavy-hitting pain medications that we will get after surgeries, after dental care sometimes, even sometimes for ear infections. And so it may start with a prescription, but the problem is abuse of prescriptions. And it's not fair to say that everyone who becomes addicted got them originally from a doctor either. These are also pills that you can buy on the streets as well. But we are talking a big part of the opioid crisis starts with the pill form of opiates. In fact, 4 to 5 people that abuse pill opiates will eventually become addicted and turn to heroin when they can't get that anymore.
Wow. Bridget, how does it go from, I come home from surgery, I'm using opioids to manage my medication that my doctor prescribed, to now I'm addicted? How does that happen?
I don't think it takes too long for a person, to get, unfortunately, addicted, because it is so powerful. And I think the most important thing is it has to be managed well. Keep in touch with your primary care physician. If the pain's not going away, try to get into some pain specialty program. Work with your care management team so you're not relying on those pills. Because I think that's, unfortunately, a lot of people don't know how to get over that, once they start those medications. And that's where we see a lot of people wanting more and more, and at one point the doctor's going to cut you off, and then they have nowhere to go, but unfortunately a lot of them to the streets, and that then becomes turning into an opioid, crisis. So it's difficult, but I think prevention, education, understanding what you're taking, ask questions, I think that's the most important part. Like I, mentioned to you when we spoke earlier, my own son, went in to get his wisdom teeth out, and immediately the surgeon's giving a prescription for Percocet. I'm like, well, maybe you should try like a little less stronger, prescription. See how he manages it first. So I think it's a community effort as well on prevention and education. So we can help, battle this.
Right. There is hope. There's a solution. People can get past this. Tell me about.
And there's no argument that pain management medication is an important part of healthcare. The question becomes when it's a first line, what you do for first line pain management. And it gets really complicated when we're talking about the brain, and we don't understand fully why some people get addicted faster than others. But the reality of when we're talking about things like the opiates, all of us eventually, by using them regularly, will become physiologically addicted. This is not a choice-based situation. It's a physiological illness. The brain needs what it needs, and when we cross that threshold and become addicted at the neurochemical level, it will change how we interact in the world and all that. So the point there is that we will all eventually become addicted to opiates, but some of us, a significant portion of us, become very easily addicted to certain substances. And that's because we're all different and our brains are different. And we cannot differentiate between the two types of people yet, broadly. So we have to be very cautious in how we prescribe pain management and how we move forward. And that will help cut down on the crisis.
Terrific. Briefly, we just have a little bit of time left. Tell me about the services that you offer, and keeping in mind that it could be a grandmother, it could be an 18-year-old person, it could be people of all ages and all socioeconomic brackets to access services if they find themselves in this situation.
Well, community health and dental care is co-located with Creative Health Services, so that's a definite bonus, where we provide medical, dental, vision, OBGYN, free transportation. We're your community health center. We also had started back in 2016 to do medication assisted treatment, which is a big program that's, obviously increasing in every area. And we work hand in hand with Creative Health as they provide the counseling, to do the level of care assessments, to make sure when people are engaged that they get set up with the right treatment plan. So.
And that's kind of the revolutionary approach now. Historically, any kind of addiction is sort of thought of as a moral failing. So that meant go to specialty care, talk therapies, AA, NA, and those are really important as part of the recovery process. But we're talking about a physiologically based illness. So it made sense for Creative Health, the region's substance abuse provider, to partner with primary care because this is a primary care illness. And more importantly, there are ways to treat it beyond talk therapies now. We mentioned, Bridget mentioned medication-assisted therapies, which help a person not only stop using opiates, but stay off them for life. There's also medications that we can give that you can get over the counter at most pharmacies now that will stop an overdose from taking your life.
Great.
And let's not make any mistake about it. The pathway now is death with addiction to opiates.
Great. We want to refer people to the resources that are listed on the screen. We have lots of places for them to go. And for additional information, for more webisodes on this topic, we'd like everyone to visit pottstownfoundation.org.